Hi there, this is Dr. Paul and thank you so much for watching this video of Waterfront Dentistry by Paul's. Today I'd like to talk to you about a treatment option which is a crown. Now what is a crown? A crown is a helmet or an armor that sits on a tooth circumferentially and protects it, being fragile on the inside. When you have a tooth with a large filling, be it either silver or white, over the course of time in the mouth, it can't really stay for too long. And this is basically because the mouth has a whole bunch of vectors. It has a lot of forces from clenching, grinding, chewing. There's a lot of saliva, there's a lot of bacteria, and there's a lot of expansion and contraction because of fluctuations in temperature that occur daily. Now, this is the reason why a tooth with a large filling will eventually end up either needing a root canal or might end up crumbling or cracking. So you can be proactive and put crowns on these teeth so that they will stay in your mouth for eternity, or you can be reactive and end up needing a root canal and then crown it, or end up fracturing a tooth and then crown it. When you crack a tooth or when you need a root canal on a tooth, these are both expensive and extremely painful procedures. So it's all up to deciding if you want to be proactive or reactive. Now, the only two disadvantages of crowning your teeth are, the first, of course, is the fact that when you shave a tooth down circumferentially, you're exposing a lot of dentine. The nerve inside the tooth gets really inflamed from doing this, and a lot of people, well, I wouldn't say a lot, but 6 to 8% of people end up needing root canals from a crown preparation. Now, to put things in perspective, if you take 100 people and you do one crown on all of them, 6 to 8 people end up needing root canals. That's a number you can live with, because if you don't do these crowns on these 100 people, regardless, there will be more number of teeth needing root canals. From a number point of view, that makes a lot of sense. The second disadvantage is if you have a cavity underneath or around a crown, which is called the margins, where the tooth meets the crown, you can't really fix it easily. You got to take the entire crown off, patch the filling up, and give yourself a new crown, or in some instances, the cavity is so far gone that you can't really patch the tooth up. These are the only two disadvantages. Now, both these disadvantages can be overcome. One is, while you do the crown preparation, you don't have to take as much tooth structures off, and that's what's happening today because materials are getting stronger even though they are thinner. So that takes that first equation out of the table. And the second is, if you brush and floss, you don't end up getting cavities around a crown. The fact is, when you have a root canal treated tooth, there is no nerve inside the tooth. There is no blood supply. So you have a tooth which is strong but now brittle. If you don't cap a root canal treated tooth, the tooth that is root canal treated will eventually crack and crumble, and root canal treated teeth never fracture superficially. They usually fracture badly, and then you got to pull the tooth out. So all the time and money you spent in the dental chair is now pretty much out the window. So it's all about thinking about being proactive versus reactive. I hope these have answered a lot of your questions. If you have any suggestions or concerns regarding what a crown is and if it's right for you, give us a call and let's see if we can answer that question. Thank you.